Hi, my name is Annelie Poge and I'm here the language trainer from Dutch for Doctors. Today I will speak to you about traps, language traps in Dutch. And we can see these traps also in medical and in dental field. And today I will really try to make clear why it's essential to learn Dutch in a good way. So some people say Dutch can be a very challenging language. So where do you see the problems? Mostly in technical aspects, such as reflexive verbs, transitive verbs, and also in separable verbs and in auxiliary verbs to form different tenses. So we have a lot of special categories of verbs which cannot be found in other languages. But in the German language, you will also find this. For Germans, Dutch is technically very easy to learn, and in general, it's easy to learn for Germans, as the two languages are closely related. In fact, Dutch can sometimes feel like a simplified dialect of German. This often leads to funny situations. Germans go from a very complex language to a slightly easier one, which can make learning Dutch surprisingly enjoyable for Germans and also very funny. However, for the Germans, there are some real pitfalls, especially when it comes to false friends, which we have a lot. There are words that look similar to the German word, but they have different meanings in Dutch and in German. Let me give you some examples. A patient asks the dentist or the doctor, Hoe maakt u het? Hoe maakt u het? And the doctor dentist replies, I make it like this. First, I do an examination, then, and he continues. Problem, the patient was expecting a simple answer like, good, I'm fine, or not bad, or simply bad. But the dentist or doctor misunderstood the communication and he started explaining the procedure. Because in Dutch, maken can mean to do or to perform. So he understand who marked it, how do you perform it, and he thought he should explain the procedure. But this was not what the patient asked for. Then the communication continues. The dentist asks, the doctor asks, heeft u pijn? The patient answers, valt mee. In German, we cannot understand fällt mee, fällt mit. What could it be, fällt mit, fällt mee? And the German speaker might misunderstood it, fällt mee, and hear something like mitfall, and you don't understand. The patient actually meant it's manageable. The pain is manageable. It's not so bad, the pain. And the classic moment comes, and the doctor dentist says, Kommt u klar? And the patient says, really shocked, Nee, echt niet. Nee, echt niet. Problem, the Dutch speaker, for the Dutch speaker, klaarkomen has a strong sexual meaning. So even though the German speaking meant, are you ready? The patient cannot understand, kommt u klaar? It's really inappropriate to ask in this way. So even for the Germans, Dutch is related but has a lot of false friends and idiomatic expressions that can cause major confusion. So especially in healthcare, you should learn the language, and I can advise you, please come to my training. Thank you for listening and have a nice day.